Hello, my name is Dr. Ann Boyo. I'm a clinical psychologist. I teach at the University of Nairobi, Department of Psychiatry. I'm also a member of the Clinical Psychology Association of Kenya. And today we would like to look at how we can take care of ourselves, and our topic will be self-care during the time of COVID. Why are we paying attention to self-care during COVID-19? One, we can think of COVID-19 as an overwhelming condition in which we are not used to. We were not used to a pandemic, and particularly that which keeps us away from our colleagues, makes us stay at home, or even when we go to work, we are worried as to whether we shall contract any disease, we shall contract COVID-19, how we shall react with our colleagues and the people we work with, especially as healthcare workers. We are worried whether the people, our patients, will get the disease from them and we take it home. Currently, we are having a spike and we are not sure what will happen to you, how you are going to care for your family as we continue. So we need to really think of how we can take care of ourselves. The period also leads to anxiety. We fear, we get angry, sometimes we get sad, and also it's possible to feel helpless, discouraged, and occasionally we feel out of control because we don't know what to do and we have to go to work. And we find that our physical responses may include having a headache, you might have muscle tensions, fatigue, sleeplessness, and any of those situations which are going to keep us awake from work. So the question then is, how can we improve? Then we try to do what self-care. And what is self-care? WHO defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. Self-care is any activity that we deliberately do. So the key word here is deliberately do in order to take care of our mental, emotional, and physical health, and thereby we are able to promote health. So keep note of the word deliberate, because that's what self-care is all about. And I'm sure it sounds very simple. After all, don't I take care of myself? Why then do we have to take a deliberate action to remind ourselves about self-care? Despite it being a very simple concept, it's something we very often overlook. And when we overlook it, then we find that at the end of it, we are like, did you take care of yourself? You wonder, did I? And you start thinking, oh, what was I supposed to do so that I can say I took care of myself? After all, I ate, I slept, or I went to work, I dressed well, and so on. Maybe from there, we can start by thinking, what are the barriers to self-care? You could start thinking of, if you're having a problem of taking care of yourself, what is it that stops you from deliberately taking action to take care of yourself? Is it time management? Which is very common for everyone to say there is no time, because we get to our employer, to our to our working place, to our clinics, and we find the day ends without having done that which we are expected to have done, without having thought about ourselves, because we are busy thinking of what our employer expects us to do, how we are supposed to relate to our patients, how we are supposed to improve. So the day end thinking about others and not ourselves. And then, is the barrier also related to workload? Either because you are employed, as you have said, or you are doing both, you are employed and you are doing self-employed, a combination of both. So is it related to my workload? Do the barriers related to whom you are? You feel guilty if you spend time alone, time just being you. Either you put your legs up, just watching a movie, having a talk with girlfriends, boyfriends, whatever you call them, colleagues, or you feel guilty that you are saying no to others who want you to be there all the time, or you do not seek support from family members and friends. So are you that person who does not want to do anything, and therefore you are always feeling guilty anytime you do something good to yourself? Is it because you are not aware that you are supposed to take care of yourself? And I'm sure we have a bit of awareness that we are supposed to take care of ourselves, but sometimes that we are like, oh, you mean I am supposed to do a deliberate action to take care of myself? Do they relate to the belief, to your profession, that I know I'm of a small body, so I don't have to engage in physical exercises, believe that I am fit because of my physique? Or I'm a healthcare worker and I know how to take care of my health based on my training. So what else is making you not be able to take care of yourself? There are many, and if you take a notebook and started noting them down, you'll be able to find a number of them, and you can be able to work around them. But the important thing is, no matter the barrier, do not be discouraged. What we need to remember is that we have read so much about self-care, and you are like, oh, I'm supposed to exercise, I don't know how many hours, you're supposed to eat this kind of food, you're supposed to do this and all that. The important thing is to remember, even as you've read and you've known all those things you're supposed to do, there's no one model of self-care for all. That which would fit me, would fit your friend, might not be the same. And this is affected by many factors: our work, our health, other issues related. So what is it that would fit me? The self-care plan you make is yours and yours alone. And there should not be any competition between what you are doing and what somebody else is doing. It's your plan and nobody else's. And make what works for you. Do not, it's good to hear what your friends do. You could find out, after all, we learn from our friends, but don't copy it 100% because you'll be frustrated, because we have different times and different things and different programs. So integrating self-care should not be one more stress added to you. Don't see self-care as a problem. Don't see self-care as a stressor. The minute you see it as a stressor, then we are saying you are not going to go ahead. You are going to be saying, oh, this is too much, another one problem, and I'm not able to do it. So you have to ensure that the one fit is yours, mine, and so-and-so's, yours and yours alone. Explore self-care that contributes to your feelings of a rewarding engagement, professionally and personally. Let it contribute. When you look at it and you wake up every day, you are looking forward to it because this is mine, this belongs to me, and I own it. And my self-care should reflect what I'm able to do at a particular time. And is not cast on stones. Circumstances can change. And once you realize the circumstances have changed, then you can be able to change it. And you can also say that it didn't work this particular time, I'm going to change it and move. So it's something which you look forward to. It's not a stressor. So our unique self-care process is not in isolation to the ongoing work. So it should not stop me from going to work. It should not stop me from feeling now my work is a problem. It should not make me feel that I'm not able to cope. So it should be able to integrate my whole day within where I work, my family, and all that. It's an integration and feeling that I'm rewarded when I carry out the task. It is when you carry out your self-care and you keep looking up and seeing whether it's working, your program, then it's a sign of wisdom, not weakness. When you feel that it's not working and I'm going to change it, then it means you are able to recognize that there's a problem, and I keep doing self-assessments. If I change, it isn't that I am weak or there's a problem. No, it means that I assessed myself and I found it's not working, and I am able to change. And I can also access assistance, that if I find it's not working this way, I can ask a friend, I can ask a professional. So it's again a sign of wisdom. And you are using coping strategies that are working for you, not for somebody else. This is what works for me. And it's sustaining wellness. It's improving me. And so if I find it wasn't working and I change it, then I'm saying it's sustaining my wellness. It's not giving me a headache. And also, it's also wisdom to know that our needs change throughout our life and our career. And as a result, I'm able to change it from the way it was and start afresh and say, now I used to jog in the evening, or I used to do this in the evening, and I can run to morning. Now I can go to a particular time, and so on. So it's not a sign of weakness, but a sign of wisdom, the realization that I can be able to change, the fact that I can ask somebody to help me. So what can I do? And once again, from what we have said, is that our self-care is that can take any form, so long as it's within a number of the following. Having a balanced diet. A balanced diet doesn't have to be expensive. It's balanced, and we know the balanced diet, what it means. It means we engage in physical activities and exercises deliberate. Not that you worked in the house, or when you're on leave, or you kept moving up and down the stairs from this ward, or you kept moving from one corner of the hospital to another. That is a physical activity. No, that is part of your work, and therefore you need to engage in the deliberate physical activities. What physical activities will you do? It's up to you. Look that which will help you spend energy, feel good, come out panting because you participated in an activity and you have the time set for it. Set aside time for yourself. A number of us feel guilty when we take time for ourselves, and when we spend a little time, when we even spend a little money taking care of ourselves, so we do not appreciate ourselves. So we need to think positively about ourselves and give yourself a treat. Set aside time for that. It could be a few minutes alone and my time. You know what works best for you. Get Support, social support, very important. Family support, very important. You know which one comes first. It could be a family support, could be a social support from friends and from family members. We should never feel ashamed that I ask for help. It's an important aspect of taking care of ourselves. We are never 100% able to solve ourselves, to sort ourselves. We shall always go to other people to help us and get professional growth. Are we growing in our professional areas? So you either need to attend a workshop in whichever method, and just as we are doing in this area, so how do I find myself that I'm growing? Because that is one way in which I'll feel fulfilled even when I'm working. It's no longer a nightmare. Go for annual medical checkup. Important. Sometimes I know it's the ladies who go because they need to go for pap smear, whatever they need to. Ladies are very faithful in this. We'd want to encourage even the gentlemen to go for it. It's one way of helping yourself. So never feel ashamed of seeking help, medical help, psychological help, emotional, work-related. Sometimes we want to feel like we are on top of everything and we do not feel like we need to help. Get help. It's a very important aspect of realizing who we are. Maintain a sleep routine, and of course this will be related to your work. The important thing is that wherever you are off, wherever you have recommended hours in which you are able to sleep. Read a new book. What do you love most? Which books? When did you last pick a book to read apart from a professional book? A storybook which is going to help you laugh. A novel. Or listen to old songs. Ringara, whatever you used to like. That which will make you happy and feel you are no longer just thinking about your work. Talk to a friend. I know these days we are doing very little social contact. Call your friend, and particularly if you get that friend of yours who made you laugh, and you make laughter part of your medicine, as we are told. You can also learn to give thanks, learn to feel good, learn to appreciate. And this is done by keeping a gratitude journal. You realize that you have things to appreciate. You want to, what went right today? What was it that was good for me despite the hard day? Was there something which I can look forward to and say, oh yeah, I thank God for this? It could be your life, it could be your family, it could even be your work, it could even be, you will know, small or big. Keep a gratitude journal and try to have every day to look forward to something that can make you feel, yes, truly today was worth living. Get a friend who works with you. Him or her will be somebody who is close to you and will make you think, oh, you've been saying, I want to do this, how is it? But it means you've got to open yourself to him or her so that you can say, oh, I haven't been doing exercises, I haven't been taking care of myself, I want to start. And then you're able to discuss. And at the end of the day, at the end of the week is like, aha, let's see, what did you do last week? Did you manage? And of course, if you did not manage, it means you're not going to cheat. You're not going to cheat your friend because you'll be cheating yourself. So keep a journal of how you are doing. It could be successes. Yes, we want to record the successes. What about the difficulties, the challenges that we experience? Are you able to keep track of them? And the importance of this is then you'll be able to, how can I overcome this the next time when I experience them? You can discuss with your friend who helps you in your exercises, who helps you in your laughter, who helps in, have I taken care of yourself? Have I treated myself positively? So that way you'll be able to find out, oh, I did not do this, so what can you do? How can you do better later? What happens? What are the advantages of self-care? When you take care of yourself, what happens? You learn yourself. You discover why you lose your temper all the time, why you are sleepy all the time, why you are unhappy all the time, and you'll be able to sort yourself, and you'll be able to find out, oh, what can I do better? You'll boost your productivity, both at your place of work, at home. You relate better with your friends, and they'll be like, oh, what has happened to so-and-so? They look different. So you find yourself becoming productive, and you are a joy to be around with. You are a joy even to your patient. You are a joy to your friends. You are a joy to your spouse, children, or whoever you are. When you have that, then we are saying your self-esteem is going to be increased. You find that you feel good about yourself, and as a result, you start walking with your shoulders high, you start smiling, you start feeling good. So your self-esteem is increased over and over, and your productivity will still go up. You are going to maintain a good relationship with others, because we do know the minute you start, you've learned yourself, you've known what makes you quarrel with others, why people are not around you. The minute you learn yourself, you find you want to be around others, you maintain a good relationship with other people, you find they want to be around you, you want to go and talk to them, they are smiling, your boss is telling you congratulations, your boss is telling you very good, your boss is telling you are doing well, your colleagues consult you, so you have a very good relationship, and you start appreciating yourself through positive thoughts about yourself, because initially you are thinking, I'm not good. Initially you are thinking, I'm bad. But now you've learned yourself. You find that I have good things. And the minute you start being positive about yourself, you start being more productive in your work, and you feel good. That feel good effect is the most important thing. As we come to the end of this talk on self-care, what can we say? The important thing to remember is we can do something every day. Does it work 100% every day? No. Can we get over 70%? We could try. We try every day. We can do something every day. Pick out of those, what can't I miss? What is it that I must accomplish every day? When you have not done what you had decided you want to do, don't give up. There's a tomorrow. When we give up, then we are seeing all doom. And we are like, let me pack everything after all, I'm not able to. We do not achieve 100% every day. We achieve a certain percentage. So what can I do tomorrow to raise my percentage? The important thing is that at the beginning it will be difficult, but practice makes perfect. If I sustain, I had said 30 minutes or an hour, if I start slowly, if it's difficult to start all at once, then I go increasing, I increase my time slowly, and at the end of it, I will do very well. At the end of it, ask, what have I not done? As you do an overall overall journal, you look, what have I not done? And finally you ask, what can I improve on? Because life is always about improvement. Life is always about trying to do better. It's life always that every day, at the end of the day, we can say, when I draw my graph of performance, I can be able to improve. Thank you very much, and I hope we shall start being serious about self-care.